Sample MMI question and expert response. That's what I'm going to show you today, but first I'd like to introduce myself. Hi, I'm Nadine Evans with BeMo Academic Consulting. We help students with admissions into highly competitive graduate and professional programs. Normally, students seek our help because they want to make sure that they can put their best foot forward the first time and avoid the dreaded rejection letter and ensuing waste of time, money, and energy. Or they have been rejected in the past and they want to make sure they don't make the same mistakes again. Before we begin, I have good news for you. If you have an upcoming multiple mini interview, we're actually giving away a limited number of digital copies of our best-selling book, BeMo's Ultimate Guide to Multiple Mini Interview, for only $5. The book sells for over $20 on Amazon, but for a limited time, we're giving it away for free. You only have to pay a $5 processing fee and we'll send you the electronic version of the book. So if you want to grab this limited offer, click the link either above or below this video. Now let's take a look at the sample MMI question and expert response. Here it is. You are the only ER doctor on duty and are responsible for all decision-making during the shift. This night, you have 2 patients rushed into the ER who desperately require a kidney transplant. One patient is an 80-year-old university professor who's suffering from acute kidney failure related to his age. The other patient is a 20-year-old university student who has been brought in for yet another episode of kidney problems related to excessive drinking of alcohol at a school party. There is only one kidney available that matches both patients. Who do you give the kidney to? BeMo expert response. Well, in this situation, as the ER physician, I understand that I have a very difficult decision. Of course, I am sympathetic and appreciate that both individuals are suffering immensely with pain as a result of their conditions. However, my decision-making will solely be guided by my expertise, clinical experience, and the scientific literature, and not by the personal backgrounds of the patients. Furthermore, the decision as to who receives the kidney will ultimately be based on which of the 2 gentlemen will benefit most from this transplant and will have a better chance of receiving the kidney and surviving the post-surgical complications. Immediately, if possible, I would place both of the gentlemen on dialysis in order to buy some time so that I can assess the situation further and gather more information, since in this case, there's only one kidney available that matches both patients. Then, the decision is tougher and will require further investigation. I can at this point review both patients' records, take a detailed history, send for appropriate tests, perhaps consult with other colleagues and specialists in the field, and more importantly, examine the current literature on the effects and outcomes of kidney transplants of an 80-year-old with acute renal failure versus those in a 20-year-old, for example. Once I have gathered all the evidence and have objectively analyzed all the risks and benefits associated with the transplant for both patients, I would then provide the kidney to the individual who, from a scientific and clinical point of view, will have a better chance of receiving the kidney and surviving the post-surgical complications. If that is the young student, then he will be the candidate. Of course, we will have to ensure that he is well educated about drinking habits so that this does not become a recurrent issue in the future. If it turns out that the older gentleman will have better outcomes, then the kidney will be given to him. Whoever does not receive the kidney will continue to be monitored and maintained in a stable condition until the next kidney for transplantation becomes available. Follow-up question. Let's assume that you do not have any time to do any further tests, nor do you have access to any dialysis machines, and the only information you have are those provided in the prompt. You must make a decision now. What will you do? Who will you give the kidney to? If you want to learn how to answer questions like this in your interview and ace any type of MMI question, click the link above or below this video because we're giving away free copies of our best-selling book, BeMo's Ultimate Guide to Multiple Mini Interviews. All you have to pay is $5 for processing and we'll send you an electronic version of the book right away. This best-selling book is priced at about $20 on Amazon, but we're giving away free copies for a limited time. This book will teach you strategies to answer 23 different types of MMI questions, and you will also get to practice these strategies with a lot of sample questions and answers. So click the link above or below this video to grab this offer now.